With malaria prevalence under 3%, Lagos, the center of excellence, is not resting on its oars, taking decisive steps towards eliminating the disease, ensuring that every fever is properly diagnosed and treated using scientific and digitized approach. Right here at the launch of the Pathway to Malaria Elimination and Digitization program in Lagos State, the final phase of the World Bank Impact Project. Experts, health professionals, government, national and international bodies agree with empirical evidences that Lagos is on the right track and closer to having a malaria-free future.
I am confident that the Lagos State possesses the needed attributes that can help drive Nigeria to malaria elimination through such pace-setting initiatives like this program.
Thank you for the boldness you brought to the task. Thank you for your beyond what I call the work hours engagement to ensure that this leadership that Lagos is committed to truly happen.
Lagos State has always been at the fulcrum of making a difference. When Lagos gets it right, Nigeria gets it right, Africa gets it right.
Commissioner for Health, who's also a professor of internal medicine, Akin Abayomi, says aside the test, treat and track strategy, government is intentional about upgrading infrastructure and boosting immunization coverage amongst other strategies in order to reduce maternal and neo mortality.
We need to stop giving arbitrary antibiotics. We need to do proper investigations and make sure we arrive at the diagnosis or be able to counsel the patient that there's nothing actually wrong with you, that you don't need anything aggressive.
For Governor Babajide Sanwo-olu, malaria is not just a disease, but also a social-economic burden that can hamper gross domestic product (GDP) growth. That's why his administration is committed to taking up this frontally, expanding access to quality care, providing education, building and cultivating a malaria-free Lagos.
It has affected businesses. It has seen a whole lot of absenteeism and a lot of challenges in our society for several decades. But today, we had to change all of that narrative. The eradication of malaria is not just a good health news. It is indeed an economic imperative. It's a good news that all of us must beat our chest and be able to carry, if there's a pin, that we need to have. A pre-elimination, the campaign for it. We need to have it, and we need to be able to dot it everywhere proudly. This program represents a hope rooted on innovation, collaboration, and determination by leveraging digital tools that will ensure that every malaria case is tracked in real time.
At the official unveiling of the Pathway to Malaria Pre-elimination and Digitization program, the Minister of State for Health, Dr. Kunle Salako, and Governor Babajide Sanwo-olu subjected themselves openly to malaria tests, and they were certified free.
Excellent Excellency of Lagos State, I'm pleased to tell you that you may continue with your duties for the rest of the day.
Congratulations, sir.
Your test is negative, in line with the low prevalence of malaria in Lagos as we chart a course to pre-elimination.
This serves as a pointer to everyone to ensure that they get properly tested. Meanwhile, Governor Sanwo-olu also announced the appointment of the Executive Secretary of EFAMA, Adetola Kayode, as permanent secretary at the event. Adetola Kayode, LTV News.